Hey friends, greetings. Dr. G here. I had a number of people asking me some questions, so I want to go into it. Number one, this is going to be a video about the COVID-19 vaccine. So first disclaimer, this is not intended to be individual medical advice. I'm going to give you my opinion based on my study of the topic. I invite you to please work with your provider and someone who can assess your individual situation. With that said, I want to present logic and science. Some of it's going to be my opinion. I'll try to differentiate those from what I think is fact versus opinion. Sometimes it's one and the same. So first off, let me just jump to screen share. Okay, so I haven't done a video in so long, I don't even remember when. Every time I would go to try to cover a topic, help to inspire, it's very disheartening with all the censorship that's going on in our world besides the disease itself. Let me go through a couple of points that have come up, specifically pregnancy and pregnant women. It's been shown that pregnant women are at an increased risk. I actually found some studies on this to answer the question, what I suspected. It's not the pregnancy itself, it's the high rates of obesity among pregnant women. And we're not talking weight gain from pregnancy. That's also calculated into this. We're talking obesity, which increases your risk for gestational diabetes, hypertension, or preeclampsia, all of the risk factors we know that raise your mortality rate for COVID. They go up in pregnancy where you put on even more weight. And so it's clear that is the cause. What that leads to, though, is to talk about prevention. We should actually be talking about what real prevention is, because real prevention is not solely occupied by vaccines, although that is the sole focus of our public health departments in the medical world. So before I go into the vaccines, though, I want to talk about in terms of prevention and treatments. I think one of the other big travesties, really, and unfortunate events that's taken place over this last year going into 2020 is the fact that a lot of treatment modalities were actually suppressed via censorship through political influence over the medical establishment and financial interests. It is reality that we live in. And so a lot of people, I believe, could have been saved and helped early and often if we had allowed freedom by the doctors and healthcare providers to actually use the treatments we have. And that relates to some both pharmacological substances and natural substances. So first off, just to review in terms of prevention. So nutraceuticals, I'm referring to vitamins and nutrients. A lot of this is now getting out there and people are aware of it. It's a no-brainer that you would want to maximize your status because the virus does not hurt everybody. In fact, by a huge margin, most of us are going to be just fine. The problem is those that are vulnerable, underlying health conditions are easily detectable, and the health status exacerbated by deficiency in these key nutrients. And so the deadliness of this virus has to do with three factors that come into play. It's the amount of exposure and replication of the virus in the host, in the individual. There's cytokine storm, which is the immune response that goes awry. It goes to an excessive inflammatory state, releasing these chemical mediators from your immune system that over-respond or create more inflammation and damage that leads to the sequelae or to the steps that leading to death. And also what's found is the third point is microthrombosis, which is in the vasculature, the tiny capillaries and areas of circulation, and especially in the lung, suffer acute inflammation, and you have this leaking of fluid out of circulation and into the interstitial spaces. This is that acute respiratory distress syndrome onset. The point of telling you those three things is we should work on preventing all three. We can reduce infection rates. We try to slow replication. Number two, we try to control the cytokine storm. Cytokine is referred to as the chemicals released by immune cells primarily in response to the infection. And then third, the microthrombosis, treating that. How do we do that? Well, on my screen share, let's see, we've got those nutrients help improve that, vitamin D, C, and A, zinc. Fish oil is just one option if you don't eat a lot of seafood. Those essential fatty acids are essential for the anti-inflammatory side of your immune system. Diet, probably should have put that number one. A diet low in sugar and carbohydrates is going to reduce a lot of the risk factors. High nutrient density, so we're talking mainly vegetables, lots of color, leafy greens, and anti-inflammatory herbs. that you should be cooking with. Herbs, spices, flavonoids, carotenoids, these are the pigments in nature that are protective. The blueberries, the carotenoids from carrots, and even in fruit, but we got to watch the sugar intake. And lastly, stress. So this could actually be a major benefit if people would apply these steps in terms of stress reduction, simple breathing exercises, using water therapies, exercise, and sleep. And water, I'm not talking about pool aerobics. I'm talking about using contrast, especially cold water adaptation, really, really beneficial. There is a guide to home-based COVID treatments authored by Jane Orient, Elizabeth Lee Villette, MD. There's a whole bunch of people that contributed to it here. This is produced by medical professionals who, because of their frustration and the lack of giving adequate treatment to people early and often at home, and what they lay out is very clearly the benefits of prescribing both natural and drug remedies for people who are at home and who are stable. The early implementation of hydroxychloroquine, for instance, ivermectin, and then some of these you wouldn't really be doing in an outpatient setting. Monoclonal antibodies, we have plasma therapies, there's antivirals, and zinc I threw in because it's often combined with hydroxychloroquine and some of these others. Also antibiotics. These can be effectively and safely used. Of 40 ivermectin studies, 100% show positive effects with 87% improvement when used early. Hydroxychloroquine, they looked at all these studies they pooled together. They said that the probability that an ineffective treatment would generate results as positive as in the 172 trials to date is less than 1 in 1,015. So unfortunately, hydroxychloroquine was vilified early simply because of a political reason. These are, by the way, ivermectin and hydroxychloroquine have a very long history of safety. So there are some specific contraindications, but I won't go into those now. Those need to be used in conjunction with a doctor. And I'll plug this, by the way, I'm happy to help individuals who want to set up care to establish that relationship, to see if you are someone who may need this at some point, some of these strategies. All right, let's move on to vaccines. So of course the vaccines is main front and center. We had in December, I think they started giving these injections. So let me just run through a few bits of data, and then I'm going to give my conclusion at the end here to answer the question, what I think of it and how do I advise those who are thinking about getting the vaccine. The Pfizer vaccine I'll reference first. It has been through 3 phase trials. So we had the completion of the phase 3, as we all heard in the news, and the 95% effective rate. But I'll point out in the phase 2 trial of 18,198 who received the vaccine, and then 18,325 who got the saline placebo. Here's some data on that. So of hospitalizations, we had 1 COVID positive, 2 COVID suspected with infiltrates versus 3 from COVID. So this is vaccinated versus the unvaccinated, just to be clear. So the vaccinated group, there was 1 COVID case positive plus 2 suspected with infiltrates. We had 2 deaths in the phase 2 versus 4 in the unvaccinated. So, okay, there was 50% fatality reduction. Lymphadenopathy here, this is kind of an immune response to the vaccine. Not surprising, there were 64 cases versus only 6. So just to be clear, the vaccinated group, 64 cases of lymphadenopathy in the vaccinated group. That would be expected because of the immune triggering of the vaccine. Bell's palsy, there were 4 cases in the vaccinated group and 0 in the unvaccinated. Injection site reactions, of course, there's going to be more there. Just a note from the trials, they excluded anyone that had COVID, who had recovered from COVID or had been reported to have COVID-like syndrome or was tested for it. And those who had taken COVID prophylaxis medications, so who had taken hydroxychloroquine, for instance, anyone who's immunocompromised, and excluded those with prior severe allergic reactions, pregnant women and children under age 16. You have to just bear in mind there's a lot of categories of people who never got included in these trials. And then finally, the phase 3 trial, there was 43,000 participants. Protection was shown to be 95% effective, found after 28 days of the first shot. There were 170 confirmed cases of COVID-19, 162 in the placebo, and 8 in the vaccine group. appears significant enough to warrant potential vaccine for everybody. Let me point out, though, of course, there was some concerns about the effect on fertility. There were no tests done on pregnant women, and that's because they pretty much never test on pregnant women because of the ethics. There is some concerns about placental formation. By the way, I'll put the reference. It's from the AAPS, Association of American Physicians and Surgeons. So this is a mainstream source. Here's my unanswered questions about the current vaccines. Okay, this is how long will the immunity last? We're not sure. We don't know. Is it effective? Is it as effective as getting the natural infection at building robust immunity? We also don't know that. It only creates antibodies against a specific part of the virus. We do know that. So the spike proteins. Viruses like HIV and influenza can adapt their binding mechanisms to evade prior immune protection. So what I'm talking about here is that the vaccine triggers specific antibodies to the spike receptor. When you have the natural infection, you are going to make antibodies to a number of components of the virus, not just the spike proteins that the vaccine provides. Yeah, and what will be the long-term side effects if those can be accurately accounted for? And I'll come around, I'm going to talk about that in a minute. Those that weren't included in the vaccine trials, we don't know. Those with substantial comorbidities and autoimmune diseases. Here's one of the biggest problems that I have in approaching this. The suppression of free speech and scientific opinion and facts on COVID-related issues, to me, presents the biggest barrier against informed consent. Okay? I don't think most people who are getting lined up to get the vaccine are handed even the published statement data from Pfizer, which is included with every batch of vaccines, at least historically. I'm assuming that's supposed to be provided, but most people don't want to be bothered by that. I get that. Okay, we want to be told what to do. Sit down, get the shot, you're good to go. Unfortunately, your health isn't that simple. You know, everybody is unique, and if you don't take an active role in understanding what you're doing and informed consent, you're more at risk, in my opinion, not just from a vaccine, but in really being empowered to make the right health decisions, because a busy doctor or a healthcare center does not always have all the data at hand and can't spend the time with you to know your full situation. They should, and many try, and some do succeed at that. I reviewed the VAERS database. So this is the vaccine adverse events reporting system. There was some federal legislation where, to protect both victims of adverse effects of vaccines and to also protect the pharmaceutical companies against litigation, set up both a fund to help pay people who were adversely affected, and they also set up the VAERS database. Now, this is supposed to be where all healthcare professionals and even individuals can report a vaccine side effect. So that, and there are some other databases available, by the way. I won't go into those. They're supposed to be data being collected through help from health professionals. But the VAERS database is unique in that individuals, you and I, can go on there and actually report. Me being a private citizen or a parent, you can go on there and report that. What am I concerned about? My concern, I put Hank Aaron's name here, elderly and nursing homes. What I'm noticing coming out, and it's being suppressed largely, is the adverse events and even the death rate that's happening from the vaccine itself. So let me be clear. Hank Aaron unfortunately passed away this month. Now, the reason I put his name here, a lot of people who are famous celebrities, you know, often help with public opinion in these campaigns with health. There was a post, he got the vaccine in early January. He's obviously elderly. He died. He's in his 80s, 86, I think. Maybe he's younger than that, somewhere in his 80s. A few weeks after his vaccine, though, he died. Now, there was some people pointing at the fact he got the vaccine as related. That is far from being in the news. We don't know. It's suspicious to me, and not just because of his case, but because of ones on the VAERS database, and I'll come to that. But there are many, many people who are actually dying right after getting the vaccine in these elderly and assisted nursing homes, etc. Now, they have other health conditions, and you have to realize that people are going to die of natural causes, which is what they're saying. Hank Aaron, the only reports are saying he died of natural causes, which is, given his health status, there were no other factors that came into play. But I'm given the way our world is right now, I am very suspicious of that and on other cases. On that point, let me jump up and screen share over to the VAERS screen. The data comes in a spreadsheet, so let me explain what this is. These are actual case reports from health professionals primarily, but some are from individuals. First, we've got their age reported down the columns over here. We have their sex, and then we've got the description of what happened. Did they die? Yes or no? That's the Y column right down here through the middle. So we've got January 1st all the way down to January 15th. So let me show you. Now, I'm not going to make any claims about the percentages of adverse events because you have to take the number of total injections and add in all these. Now, I've heard estimates stated, though, that adverse events are probably only reported about 1% of the time historically from the total number. So you have to remember that the VAERS database is actually an underestimate. This column over here, it's hard to see it, but the J column, if it has a Y in there, that means the person died. Okay, now these are all reports after the vaccine. So we have a male here, age 51 years old. He died. Now, if you click on this, you can read the specifics. Yeah, he had COPD, so we know there were, but again, these are being reports because the people died within a close proximity to the vaccine. Here's a 70-year-old, 85-year-old. All these people died. So we're just in January 14th, we have, that's like 20 deaths from, I shouldn't say from, but in association with the vaccine. Now the ages, of course, these are all elderly. There's a 56-year-old, 43-year-old. See this person, these stories are tragic. You can read exactly. Now they don't always put all the information in here. This person reported initial pain in the back of the head, extreme headache, some vomiting at emergency, went into a coma and was intubated. Okay, yeah, this was acute brain aneurysm, 14 hours after the initial symptom. This is all the vaccine adverse events. And so these people who are elderly, they're only getting the COVID-19 vaccine right now. Here's some more elderly. We have a 25-year-old. Some of these, by the way, are healthcare workers. There was one case here, this 28-year-old in New Jersey. And on the day due for second dose, patient was found unresponsive at work in the hospital. Patient died, cardiac arrest. Let's see. Why am I showing you all this? So here's the 13th. We've got, oh wow, there's even more. Bad day. 13th there were, oh wow, there's 75 or 80 reports of adverse events. Now again, you have to look at this J column for death. Okay, I can see them here. So this 90-year-old died, 91-year-old, 83-year-old. Most of the deaths are elderly, 60-year-old, 56-year-old, 78-year-old, 62-year-old female. Let me look at this one, the 13th. No adverse effects from the vaccine seen on 1-2. So 1-6 resident was seen, pump was filled. She got some other conditions. Long descriptions of what all went on. She was put on oxygen. Yeah, again, to be clear, we have to just take this data on. We can't determine cause and effect 100%, but obviously cause of death is a medical opinion. We have to go through the data. And these are all the adverse events that are being reported, again, for those who are doing it. So I'm just gonna leave it at that. And you can go all the way up. Here's Jan has a 12th, there's a ton of them. Some of these are incomplete, so that just means they didn't fill in everything. Received the first dose, Bell's palsy, palpitations, yes. Age, vaccine, yes, this person died. 29-year-old. Okay, so here's an anaphylactic. About 15 minutes after vaccine, her heart rate 155, fever 102, covered in hives, sick to her stomach and a pounding headache. Has had headaches since then and been extremely fatigued. Now this case, I don't think she died. Yeah, because that's row N. Okay, so it's just an adverse event. I want to be clear. I'm not saying that all of these. Here's a 33-year-old though. Flaxus, 63-year-old. Difficulty breathing and death. My mother, here's somebody reported. My mother was given Pfizer vaccine on Thursday and she died 3 days later. Yesterday on Sunday, 3 exclamation marks. Hey, I feel that that's got to be heart-wrenching. Patient received How old do we got here? 56, female. Patient received the first dose of the Moderna and was found deceased in her home the next day. 34-year-old, let's see, she did not. This was an anaphylactic or a allergic response. All right. This is part of my problem with the I am not an anti-vaxxer. The term is stupid, frankly. What that term is, to me, that's a way of really driving a wedge with scientific discussion around this. It's assuming that anyone that has some problems with vaccines is given this label, like they're conspiracy theorists, paranoid, not wanting to follow science. I have worked with countless individuals, especially children, parents brought them in, where there is a clear cause and effect adverse event from a vaccine. Some of them are minor and gradual, but lifelong in terms of its impact. And what we've done is we've downplayed these for the sake of public health. We don't want to put negative conversations onto vaccinations. To me, that's just not good science. I think that we need to be balanced. We don't need misinformation, but we need to get the full grasp of what's going on. So let me hop back. Let me wrap up, because I was going to give my final opinion here, my little statement to wrap up. I was going to talk about masks, but we'll save that for another video. I've done enough on masks. So my opinion. So based on the historical and scientific evidence to date, the true risk of vaccinating is unknown. And this is, I'm talking about the COVID vaccines, because what I'm saying by that is we don't have data on millions and millions of people getting this yet. People of all spectrums of health status and age, sex, ethnicity, etc. I'm saying we don't know the true risk. I think anybody who's being honest with the data would say that we streamlined this for the benefits of protecting as many people as possible. That's the hope. And this is my opinion. Therefore, I don't advocate for healthy individuals to get the vaccine. If you aren't healthy and don't want to take personal steps to improve your health, the jury is out as to whether the risk-benefit profile favors you getting the vaccine. If you have had a confirmed positive test for SARS-CoV-2, by the way, so if you have known to have had it, or you currently have detectable antibodies, it is unnecessary for you to put yourself at increased risk by getting the vaccine, in my opinion. There is some controversy as to how long is the immunity last after you have COVID-19. If we follow science historically, we know how viruses, the body affects the response. The immune system makes you immune. Now, mutation, just like with the flu, other viruses, they mutate quite quickly. There's only so much immunity that is going to be carried forward. But that's where this innate immunity is so important, meaning how healthy you are with those other factors that I talked about: nutritional status, your barriers that your body has to protect against infection. All that matters. That's the true preventative medicine. If you have a history of diseases that affect your immune system, such as autoimmunity or just impaired immunity from many host of conditions, cancer, etc. Again, it's individual. I won't talk about your specific situation. A history of allergy, then I'd advise more caution in conjunction with your research, your healthcare provider. Naturally acquired immunity is different from vaccine-acquired immunity, okay? It's possible that a vaccine could protect you as well as naturally acquired immunity, but it depends. The vaccines are quite different, and this vaccine is a messenger RNA vaccine. It's very, very unique. There's maybe only one other vaccine that's used that type of method. We don't know yet. So that's it. I'm going to call that a wrap. I'm just saying, if you're going to get it, you're in a bit of an experiment right now, and you have to weigh the risk benefit yourself and decide. Based on the risk factors and knowing what I know about how we can protect ourselves, I would say that, whether you get the vaccine or not, you can always do the other preventative steps, and you should, because you may lower your risk of an adverse event from the vaccine itself by doing that. I would be doing a functional medicine assessment, checking your inflammatory markers. Do you have undetected comorbidities? Do you have antibodies already to the virus? If so, that should go into your decision-making process. I'm going to call that a wrap. Thanks for watching this video. I appreciate it, and sharing it. It's always helpful, and questions to engage in the topics that I think matter, and I hope they do to you as well. Thanks again. Take care.